Good afternoon, Dr. Aloia. Thank you so much for joining me for January's SSAT Mentor of the Month session. To introduce myself, I'm Heather Lillemoe. I'm a chief resident in general surgery at Vanderbilt, and I will be entering surgical oncology fellowship next year at M.D. Anderson in Houston, where Dr. Aloia is currently a professor in the Department of Surgical Oncology. I was fortunate enough to spend my 2 professional development years with Dr. Aloia, learning from him in his lab, doing research, outcomes research, and quality and safety. But I was also fortunate during that time to hear him give a talk to the fellows about leadership and building a practice. And I thought that would make an excellent theme for one of these Mentor of the Month sessions. So I will let you introduce yourself, Dr. Aloia, and then we'll fire away with the questions.
Thanks so much, Heather, for the opportunity to present in this forum. It's such a great thing to connect, certainly as having been a member of SSAT for the better part of my career, such a fantastic endeavor, and I congratulate the leadership of SSAT for supporting you and including me, and for supporting this forum, and hopefully, talk about some things that surgeons don't usually talk about and share some insights.
Excellent. So our first question revolves around leadership. What do you feel are the key skills that allow someone to be an effective leader?
So great question. I think I probably have 3 rows of bookshelves full of authors trying to answer this question, which probably means that nobody has the perfect answer. But having done a bit of work and a bit of thought on this subject, I do think there are a couple very relevant things. And I think one of the first things is we think a lot that people are like born leaders. And certainly there may be the occasional person that just has that perfect combination of, charisma, intellect, people skills, etc. But encouraging for the rest of our mortals are that many of these things are learned, and that through actual, application, through reading those books, through taking leadership courses, which have become very popular for ascending surgical leaders in particular, that we can become better and indeed excellent at becoming leaders. But certainly there are some fundamentals that underlie it, and the one at the top of my list is integrity. And I really think that is the foundation. And integrity means a lot of different things. It's not just kind of honesty or things like that, but it's a lot to do with communication and transparency. So to say that you're honest means you actually have to communicate something. You can't just be silently honest. And so I think a lot of us evolve over time. In some ways, the surgical disciplines don't lend themselves to transparency. There's a lot of paternalism and quick decisions that have to be made. But both with our colleagues, with administrations, and particularly with patients, I'm proud to be part of a generation that I hope the idea continues that we should be quite declarative about what is honestly going on, and then that produces dialogue, and that communication, like any relationship, I think creates an effective leader.
Excellent. I agree. I think that was a very good point about open communication. It's something that's helped a lot during the pandemic, at least here. Having an open line of communication has been key. The next question is, what is the difference between a leader and a manager?
Yeah, good question there too. So I think the real big difference is how far in the future the horizon is, really. I think we tend to view managers more like implementers, more involved with the tactics than the strategy, which are more cognitive. Um, and but a leader is there to look out ahead and to kind of see the future. The interesting part of that is a lot of people think of it in the positive, meaning the leader is finding opportunities that are out there that other people don't see. And what I've learned in particular from our current president, Dr. Peter Pisters, also an HPV surgeon by training, is a ton of leadership is actually avoiding the pitfalls that are out there in the future. Mm-hmm. And being the most effective leader in many cases is the most effective risk manager. And you know, in some of my training with my master's in healthcare management, they talked a lot about kind of leadership is a little bit like thankless, and you have to have a thick skin around that. And I think it comes back around to this point because if you are a very effective risk manager, no one sees that the thing that was gonna go wrong didn't go wrong. You know, a smooth road makes it seem kind of dull or boring. And as you know, one of my phrases is, you know, my goal in the operating room is to make it the most boring case ever, right? And so I think a secret part of leadership, and maybe in an opposition a little bit to management, is you know, that risk awareness, risk mitigation, and making it look easy and boring.
Mm-hmm. Mm-hmm. Awesome. The next question is, can you discuss the importance of goal setting as it relates to leadership and to success in general?
Yeah, this is a huge one that I'm a big believer in. And like every one of my responses, very few of these are original ideas, and I don't want people to think that I came up with any of this. But the most salient story I have about the goal setting is, and I don't know who the author or instigator was, but somebody looked at a fairly famous graduate program in business, and they tried to define the factors of this small cohort of their graduates that was just like in the stratosphere of success, like just those rocket ship people that took it to like an entirely different level. It could have been revenue or innovation or whatever it was. And long story short is they went through hundreds of different factors, and the one consistent factor was that subset of, you know, kind of cream of the crop people that hit it out of the park wrote down their goals. And you know, it's interesting, people have done even more research on this, and we're very electronically tied. So people are like, oh, well, if, you know, if I make a note on my phone or I text myself, you know, my goal, so I keep it around, it's actually not quite as effective as putting pen to paper. There's something, you know, kind of in our neural networks, when you write something down, it has this object permanence. And so it may seem a little bit corny, but like at the beginning of a year, if you take, you know, January 1's right around the corner, you write down, you know, a professional goal, a personal goal, and maybe a third X factor goal. And you put them in an envelope and you don't open them until December 31st of the next year. Apparently, the act of doing that makes you like 400% more likely to accomplish those three goals.
Wow.
So I think it's really mission critical, and it comes back around to something that we talk about in leadership that surgeons are also not inherently good at, which is giving feedback.
Mm-hmm.
So when you talk about mentor-mentee relationships, one of the best ways to kind of ice break those relationships that are typically difficult for both parties is to just focus on a set of goals and the joint dialogue of creating a goal set. Mm-hmm. Then when you meet 3 months later for feedback, it can structure that feedback and it doesn't feel kind of threatening or punitive if mm-hmm. you have an agreed upon goal set. And, you know, if a mentor and mentee agree upon goals and then they aren't accomplished, it's both people's responsibility.
Right.
You know, like, what did I not do to mentor that person towards where they wanted to get to? And, you know, for the mentee, like, what did I do or not do to create success or failure around those goals? So I can't say enough for goal setting. I think people tend to wimp out a little bit and be like, oh, well, I'll just think about my goals. But the key is to put pen to paper.
Yeah. That's interesting. My former program director, one of my mentors here, has the exact same advice. And I had to physically write down our 3 goals at the beginning of the July 1 when she was program director. So I like that advice. The next question is, can you discuss the importance of emotional intelligence to leadership?
Yeah, this is an incredibly deep topic. It's something that I think all current leaders have to learn about and address. It's clearly a hot topic in leadership. Mm-hmm. Tons of books written about this. I think maybe a unique take on emotional intelligence, a couple different aspects of it. You know, for some people, it's hard to kind of wrap your head around what exactly does that mean, emotional intelligence? And at its most basic, I've explained it to people, it's just the ability to read the room. You know, if you are on rounds and you start talking about a patient and your intern gives you that like puppy dog head tilt, like, it's an immediate sign, like, I do not understand what you're saying. Mm-hmm. And if you don't recognize that and you just drone on and on and on, that's a lack of emotional intelligence. And also, it's not picking up the positive signals. So, you know, a lot of people struggle with public speaking, but, you know, one of the main things is to find that friendly face that's like smiling back at you and seems to like get it and enjoying and engaged with what you're saying, and then spend the rest of the talk just talking to them, and it will become kind of like infectious. Mm. So, you know, I guess number one is the definition. You know, what do you really mean by emotional intelligence? In my mind, the most basic thing is that you have some self-awareness of the impact that you're making on others in the micro and in the macro. Mm-hmm. And kind of seeking out that litmus test, like, are you with me? Are you getting me? Are you agreeing? Are you disagreeing? Things like that. One of the things in the talk that you referenced, one of the most powerful questions in the entire world is, what do you think? So as you go through interactions, it turns out, for good or for bad, humans are built about 80% just to listen to themselves talk. They're not really interested in the other person's opinion at baseline. And so if that's true, then most of the time you start a conversation, the other person kind of has their own agenda and it's not your agenda. And as soon as you sense that, if you just stop and say, well, what do you think? And then listen, all of a sudden you will totally reset each other's levels and have a much better chance that you get on the same level.
Yeah.
And not stay at these different places. So
At each other.
The last part of emotional intelligence that I think is super important to recognize is, I think emotional intelligence has been overused, particularly when describing surgeons, as to say you must blunt all emotion. Like you must remove all kind of passion through anger should go away, and you should never access those things. And for the stereotypical surgeon who is thought to live in those spaces, you know, it's discordant. What I don't think that's what actual emotional intelligence is. Emotional intelligence is reserving those extreme reactions to only the small set of completely egregious things that are going on. So, you know, as you go through leadership, you know, you may meet dishonest people, you know, people embezzle money. I mean, there's all kinds of things that go on. And of course, you should have the ability to react in an immediate and emotional way. It always has to be with respect, but I push back against people that say that emotional intelligence is that you can never get emotional. Right. Because I think it's a matter of scaling emotion to need.
Mm-hmm. I think that's a good point. I hadn't heard that before, honestly. I guess shifting gears a little bit to building a practice, if that's okay.
Sure.
What would you say the most important thing is to someone going out and building a practice? I guess if you had to pick one thing.
One thing. Well, I think the old saying about consults that you should be available, affable, and able, it holds up. It honestly holds up. And if you talk about building a practice, if you know, so many of you guys are so well trained and you're so able. I mean, that's not the issue. So it's that availability and affability. And I think availability, none of us have a problem, you know, spending 120 hours in a hospital and always being there. So if the X factor to success, then you're left with the affable one.
Yeah.
And I think if you look at, you know, your faculty, your colleagues, your fellow trainees,
Yep.
There's a group that, you know, brings a positive attitude.
Makes all the difference.
Right. Mm-hmm. Exactly. Makes all the difference. And, you know, the only two things that we control in life is our effort and our attitude. Everything else is out of our control. Like you cannot control the environment around you. All you can do is work hard and bring a positive attitude. So if you're going to come with a crummy attitude, you're giving away half your power. You might think about it that way.
Yeah.
So on the flip side, we talk a lot about benevolence. It turns out that there are very few intentional assassins around us. Most people are working from a point of positivity, trying to do good. We're all fallible. We may make mistakes, but there are shockingly few of us that are intentionally malicious. So if you understand that and kind of can be benevolent and give people the benefit of the doubt, stay positive, the practice will come to you.
Awesome. I think that's good advice. What should someone look for in their first job? Kind of along those same lines.
Absolutely. Yeah, this question was actually the genesis for the annual talk that I give to the trainees about how do you start your practice. And I have to say it was over many years of watching all kinds of trainees move residency to fellowship to attendingship, fellowship to first job, all that kind of stuff. And it's such a challenging process, that first job. And we noticed that at many of the top programs, as many as 80% of trainees will change jobs within 5 years, which speaks to a broken algorithm, right? Like, you train for 10 years, your first job should be endurable. You should not be moving again in 3 years. Like, there's got to be something broken about the decision making, or there's something systemically wrong if our best and brightest don't hang in their first job for a few years, more than a few years. So, we started cataloging, what factors were going into the decision. And, it gets into all the delayed gratification stuff, right? So it frequently can be prestige of the institution. It can be income. It could be square footage of house. It could be distance to in-laws, both sometimes near and sometimes choice of making it very far. It could be a lot of different factors. And it turns out none of those predicted longitudinal employment at the first place of work. The one factor that absolutely predicted it was the presence of an engaged mentor.
Sure.
It totally came down to, did you go somewhere where there was somebody, and my definition of mentor is that the person cares more about your success than their own. Like, they've already written all the papers, gotten all the grants, they're full professor or whatever it is. They've achieved what they needed to achieve, and now they can focus on you as the mentee. And when people went to those positions, you're talking 10-year runs, 15-year runs, and it cannot be overstated the family disruption, the financial disruption of switching after 3 years, just starting over. Do you delay your promotion because you didn't stay? Certainly the fastest time to professor is going to one place and staying there for 10 years. You're highly likely to move up and move up. So what I strongly encourage all of our trainees to do is make decisions, yes, on family relevant things, but at least next on, is there an engaged mentor? Because that actually predicts your highest success.
Yeah. Awesome. I think I will probably move to the last question. I guess particularly evident right now in the difficult times we're experiencing and how tough of a year it has been. Burnout can take a toll on a surgeon, on anybody. And just wondering what advice, what suggestions do you have for surgeons, trainees, but also other surgeons in practice for mitigating burnout?
Yeah. There's been a lot of really good insights from physicians and mainly surgeons about this this weird kind of set of assumptions around burnout and resiliency, and that people are constantly offering us advice on how to become more resilient. Mm-hmm. When it turns out we're like the most resilient people in the world. Like the ability to train for 10 years, delay gratification, maintain relationships, have camaraderie, like we're actually at the elite end of that. So it's not a personal problem. Mm-hmm. Like it's the system, not the people, that cause this. And so the fix is not come fix me or you. The fix is go fix the system. And I think that's starting to get some traction, that people are stopping to look at the individual and kind of like blame them for their burnout and start to look at like the actual root causes. Yeah. And there's a really brilliant book on this called Toughness by Jay Billis. Mm-hmm. And he comes at it completely from a athletic team perspective, mm-hmm. which may not kind of hit home with every single person, kind of the athletic references. But he makes a compelling argument that resiliency is related to teamship. And so if we kind of think of that, you know, in the micro, the team you have in the OR that day, yeah, and the camaraderie you build with all members of that team, regardless of rank, creates resiliency in you and the ability to handle the stress of the moment. Mm-hmm. And in the macro, like, how much teamship is in your residency program? Like, does your chair invite you over to barbecue before COVID? You know, but how many Zooms are you having with each other? So as COVID isolates us, yeah, we're actually far more likely to burn out. And the antidote potentially is teamship. And so to the point that we can foster that, we may actually create that buffer around our core groups and our larger groups. You know, I would say, you know, for example, even the SSAT is continuing to engage its membership in dialogue. Mm-hmm. You know, they seem like little things, but all that building of teamship is what keeps us from burning out. And it's the same, you know, kind of at home in our families as well. Like, how many Zooms are you doing to your grandparents, to your cousins, to, you know, your friends from college? All of that stuff gives us that little buffer from burnout. And so, you know, I really point to that. It's interesting. When I started my residency, there was no 80-hour work week. And when I finished it as a chief, we had it. And, you know, we used to do midnight rounds. And so you'd have the on-call chief in-house. Mm-hmm. You'd have 2 4s, 2 3s, 2 2s, and 4 1s. I mean, it was like a massive team. And you rounded on every patient at midnight. That was the tradition. And by the time I left, it was like a chief and an intern. And I think we lost some protection. You know, it was insane hours, but at the same time, we were together and there was a teamship. And, you know, I just wonder in surgery that part of this burnout is related to kind of breaking apart the big team. Certainly, we've gotten way more balance and we're better for it, but also there are some of those areas.
Yeah, I think that you hit the nail on the head with the COVID isolation. I mean, we're all seeing that, but the camaraderie, it's hard to maintain during all of this, and you don't realize how much you miss even just going to M&M or Grand Rounds and seeing the whole group, and none of that obviously has made it a little difficult. But
yeah, and you know, if you look at the people that have emerged as successful leaders amongst COVID, the common thread is communication. They're constantly bringing people back together, having webinars, you know, town halls, et cetera, et cetera. So, so that's the key. And you know, it's not necessarily in surgical DNA to be the extrovert, but potentially that's really the key to leadership in these difficult times.
yeah, well, I think I have to wrap us up. But thank you so much, Dr. Aloia, for joining me and for doing the Mentor of the Month. Really appreciate your time.
Absolutely. Thanks for the opportunity, Heather.
You're welcome.